This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with someone who really understands what is needed of leaders in healthcare during our tumultuous times. She's Alexis Stiles, and she leads Spencer Stuart's global healthcare practice, and I've worked with her over many years on multiple searches for CEOs. I can tell you she really knows people, she really knows healthcare, and she has been thinking a lot about how leadership at academic medical centers in particular needs to evolve. Alexis, let's start by asking you to quickly summarize the headwinds AMCs are facing as they plan for the future. We know the headwinds are intense, and I know we could talk a long time about them, but a quick summary of the top three or four so we can get to what do we do about them?
Thank you, Tom, and really great to be with you today. So really appreciate the opportunity to speak. And you are absolutely correct that the headwinds are very intense and continue to feel like they get intenser every day, I think, for many. But if I were to sum up in the top, 3 to 4 headwinds, first one that I would point to is just the financial model that exists to support academic medical centers is truly at risk and in many ways is breaking. You're faced with a funding model that is really very difficult to navigate right now with reduced government funding. That includes both the NIH funding, but also threats to Medicare and Medicaid that is costing many of those health systems a significant amount of revenue dollars that they've been used to. That coupled with raising labor costs, which just continue to rise, and some of the shifting market dynamics that exist within the environment for delivering clinical care, and particularly many entrants to delivering low-cost clinical care, it has a threat on many of your academic medical centers in terms of really being able to fiscally support their operation. Second, I would say a lot of the cultural and political pressures facing academic medical centers are intensifying with a number of, the early executive orders that came on, a fair amount of mistrust right now that is going on within science and academic institutions, a fair amount of medical misinformation that exists out there, some vaccine skepticism, and a fair amount of polarization that is impacting all of us, I think, in our day-to-day lives, but has a particular focus within an academic environment. And then third, just the real talent challenges, and I know we'll talk about this a little bit more, but the workforce pressures that have faced many of the academic institutions, lingering post-pandemic that have continued to intensify, particularly with the focus that many are looking for, with a better focus on well-being, more work-life balance, and really advocating for a work environment that people feel comfortable in and feel safe in. In addition, just to the mobility that we're also seeing, so many folks who can travel and do take advantage of that, and then frankly some of the lack of travel that I think is impacting some of our researchers and clinicians, particularly from outside the U.S., coming in to both train and study here. So it is a fair amount of pressures. Those are three, but a lot of implications in all of them, I think.
Well, those really are headwinds. I mean, they could be considered almost the ingredients for a panic attack, but you can't panic when you're the leader. As you look around the country, what are the most common steps that leaders of academic medical centers are taking? I can tell you that the nightmare among many of my colleagues is that they might just be trying to be the last iceberg to melt, just trying to hang on. But is there a more positive perspective that you see some leaders adopting on what they are doing and what they should do?
Thank you, Tom. And the headwinds clearly are intense, but I also think the individuals and many folks who are both working within academic environments, but also those who look at our academic environments as really being necessary in our environment and committed to that mission and committed to what they provide in terms of an environment for research and education and really cutting edge tertiary and quaternary care. That many of your leaders are trying to address those challenges as best they possibly can, and really trying to take them head on, and dealing within the complexity of that environment. So, a couple that we would point to that we're seeing some of your more progressive leaders take action on. One is really looking at organizational structures. So, how can you operate in an environment where you can be a bit more lean from a cost perspective, and yet continue to deliver the same mission. So you're seeing some organizations merging departments or creating institutes or integrating missions to address financial and workforce pressures. Some of those are disruptive, but they certainly are creating a change and are really designed to help address some of these headwinds to position the organization to be successful and fiscally solvent in the future. Includes also flattening some of the hierarchy that may have existed. You're also seeing a number of institutions really rethink how they've addressed mergers and acquisitions and other growth areas. So really looking from, instead of being kind of opportunistic in terms of looking at growth, really very, very strategic in how they address growth and making sure that it really is aligned with the organizational needs and is addressing a market need, such that it will be seen as additive and truly driving the future of the organization, which is distinctly different than just being a recipient to those who would like to be partnered with an academic institution. I think finally, or a couple more that I might say is, one is looking at how you think about leadership and leadership qualities. And again, I know we'll talk a little bit about this, but the history of many of your academic medical centers is wanting to have someone who's truly skilled at all of the academic missions leading the organization. And I think you're now looking at how do you actually now build a team of folks who are working together, complementing each other, so that you can have excellence across all the missions, but not necessarily have to be resident in one individual. And so you are looking at the prioritization of more of the business skills and operational skills and fiscal management skills, in addition to the ability to lead and govern within an academic environment and an appreciation for how to build research and clinical and education in that overall ecosystem.
The array of themes that have to be taken on that you described, they're so different from what I was experiencing when I was growing up in medicine, where we were looking for leaders who had deep insight and experience with research, and deep insight and experience with patient care, and deep insight and experience with education. And the kind of strategic issues you're describing are not necessarily what leaders of my generation were trained for. So so how do you see the profile of the academic medical center leader changing as you do searches for these organizations today?
Yeah, it is a really good question, Tom, because I would agree with you. Usually in a typical academic environment, you are reviewing the CV first and really looking at the academic accomplishments before you're diving in and understanding what they may have led, or administratively the results that they will have achieved. And we're seeing a bit of a shift in that in the last handful of years, to really looking at folks who have demonstrated strong leadership capabilities first and foremost, and again, not sacrificing what someone has done in the environments in which they've operated, but really looking for that person who can be the leader first. And then how do they assemble the team underneath them to complement them and be able to address all of the missions and be supportive of that. So you're looking for someone who is able to support all those missions, but doesn't necessarily have to embody all those missions themselves personally in order to run the overall organization.
That is an interesting evolution. You're not necessarily looking for the person who is going to be the smartest person in the room on every single issue. So what would you recommend to the generation that that is not far from leaving the stage, the baby boomers, my generation. What should we be doing to prepare the next generation of leaders for academic medical centers?
We would say to really try to help identify individuals that have a desire and an aptitude for leadership, and providing opportunities for them to lead early in their career. It is very hard to have not led anything and get to halfway through your career and then step into leading a large organization. So our strong recommendation is for those who are desirous of or have the aptitude for us to tap them, and really encourage them to take on leadership roles early and often, and that can include more traditional academic leadership roles like a division chief or a department chair, but also could be leadership within the hospital and health system, from a service line leadership role to a chief medical officer or chief quality officer leadership role. Because the more opportunity that you have to see how the overall ecosystem works, the more opportunity that you'll have to step into a broader leadership role. We'd also encourage not pigeonholing people into one role or another, because to help develop your next generation of CEOs, they do need to have exposure to a broad array of experiences across their careers. So again, not just an academic career, but seeing the clinical enterprise and how that operates, partnering with others and encouraging them on how to build a team. I do think it continues to be a real strength for mentorship from many of our senior leaders, and sponsorship from many of the senior leaders today, which is encouraging, promoting, developing those folks who have aspirations to be senior leaders, and helping educate them early, and give them exposure to things early in their career.
Well, that message that leaders should have as one of their core competencies, preparing their replacements, is an important one. What advice would you give to the younger people, the millennials and the Generation Xers and the Generation Zers? What should they be doing to help prepare them for being ready to take these leadership roles when they become available?
We are very strong proponents of actively manage your career, and truly let your aspirations be known, not in a threatening way, but I think in academic environments, we've traditionally had individuals with the mindset of, if I work hard and do a really great job, someone will tap me and recognize that I'm ready for the next step, and I will get heavily recruited. I think in today's environment, making it known the development opportunities that you'd like, the aspirations that you have, and really seeking out mentors and sponsors who can be helpful to you to help provide those opportunities really is important for the next generation. We would also say focusing on some of the skills that are not just, that are a bit more of the leadership skills that will also be required of this next generation to really lead and inspire. So things like communication skills, and being able to develop a truly transparent, honest, empathetic way of speaking and engaging with audiences is incredibly important. That is, not everyone is able to do that, and it can be a practiced skill that folks do need and will need in the future. In addition to really thinking about how a system works, and so whether there's the ability to get some more business orientation, does not require you necessarily to get a degree, but to have an opportunity to be mentored by someone who can teach you about how the financial aspects of a health system and an academic medical center work, but also how the overall system works together, from the medical school to the health system to the practice plan to the university, how all of those components come together, their priorities, how they interrelate, and how you think about trainees and faculty and patients and all of the individuals that you're really looking to serve. I think having that systems level orientation also is important for folks to get early on so that they can see how all of the pieces function together the higher up they go within an organization.
Well, your comments made me think of something my younger brother, Richard Lee, says when he teaches undergraduates at Harvard. They often ask him how should they think about their careers in the AI era, when it seems like AI is going to be able to do almost anything. And he always tells them, think about work that is going to go much better if people can look you in the eye and trust you, and then try to figure out what kind of training you need to do to be the kind of person that people can look in the eye and feel more trust. And I think that you were actually laying out the kind of skills and experiences one needs in order to inspire trust when people look you in the eye and that you discuss doing very difficult things. My last question then is, knowing the headwinds very well, and knowing the farm system of young potential leaders coming along, do you feel optimistic or do you feel pessimistic for the future of AMCs?
I feel really optimistic. You're talking to someone who has partnered with, worked within, and rode alongside many of our leading academic medical centers. And while there are the headwinds that exist, there have always been some headwinds that have existed within the industry. And to me, right now, you've got a really committed group of leaders within the industry who are committed to ensuring the future success of academic medical centers because of their importance in our ecosystem in so many different ways. And that energy and being able to talk to many of the leaders who truly are passionate, truly are committed, and how they inspire the next generation to also share that. Yes, it's going to require a fair amount of creative thinking. We might need to break some of the norms that have existed within academic medical centers for many years. But I'm super optimistic about the future and about the ability for them to both sustain but also thrive in what will continue to be a complex environment. But I'm someone who would bet on the academic medical center to truly be the winners in this scenario.
One chief medical officer at an academic medical center pointed out to me, it is possible to be both optimistic and grumpy. And because his wife is always saying to him, if you're such an optimist, why are you so grumpy all the time? The challenges are great, but I do agree with you. Failure is not an option. The work is too important. And when we take a look at the young people coming along, they are terrific. And yeah. I think your comments today are terrific for laying out how we should be nurturing them, how they should nurture themselves to prepare themselves, and then what we should be looking for as we select the next generation of leaders. So, Alexis, thank you so much. I always get a lot out of my interactions with you in talking about talent and how we use that talent. And I'm hoping, expecting I'll continue to learn from you in formats like this podcast and others for years to come.
Well, my pleasure, Tom, and it's always a pleasure to speak with you. I really enjoyed it and really enjoyed the back and forth, and likewise learning from you. It's a true honor. So thank you very much for inviting me to join you.
Is race a medical fact or a flawed assumption? What happens when medicine gets race wrong? I'm Rachel Gottbaum, and this is Intention to Treat from the New England Journal of Medicine. Join us for Season 2, The Race Equation, where we examine assumptions about race that are harming patients. Listen and subscribe to Intention to Treat wherever you get your podcasts.